An advisor to the World Health Organization has urged governments not to use lockdown as the primary method of controlling the spread of COVID-19. With that advice, would you consider revising the strategy?
Well, we have followed a strategy that is not using lockdown interminably. We are using the restrictions that are in place now to drive the case numbers down so that we can get to the very thing that WHO is talking about, not having restrictions in place in the long term because you can control at a sustainable level. Either, as is the National Cabinet decision and the national strategy, no community transmission, 0 cases of community transmission, that's nationally agreed, or if we can't get there, at a level of a few cases per day that is sustainable in terms of follow-up and management of the outbreaks and the contacts that we need to follow if that's the case. So we're not out of accord with WHO advice, and WHO advised 200 countries and regions of the world, almost all of whom are not at this point, almost all of whom will need to manage a much more significant ongoing level of transmission. And they're speaking to the harms of restrictions that are in place ongoing. We are mapping out, as is explicit in the roadmap, a gradual easing to a point where we're getting to a COVID normal. So in that sense, WHO would be supportive, I imagine, of that kind of path that leads to the lifting of restrictions that allow people to have their well-being and health and psychological health supported.
How is the 5-kilometre restriction? There seems to be growing need among the community to have it expanded or removed completely. A couple of weeks ago, we did ask Alan Chang how we came to the 5 kilometres, and he said that it had been successful at reducing movement, but he couldn't really give a reason. He said, I think he said 5Ks, 12Ks, it's an arbitrary figure. So can you just talk us through why it's 5 kilometres opposed to 10?
Look, it is ultimately a decision about what is proportionate for reducing the amount of interaction from one person to another person, one household to another household. You could choose different distances. As I've mentioned previously, Israel's down to 100 metres from your home. Spain went to 150 metres for weeks and weeks on end. 5 kilometres is a judgment about where people can reasonably go for exercise, where people could reasonably go for the permitted reasons without increasing too significantly the number of other people and households they come into contact with. When you double that radius, you're multiplying by 4 times the number of households that you can potentially come into contact with. So it's just trying to make a judgment about limiting interactions to an extent possible, but allowing people to have some opportunity to find a park, find a walking trail for the purpose of exercise.
Considering people in outer suburbs and semi-rural areas with less density have fewer friends and family, not as many parks, not as many shops in their 5Ks. How conscious are you of the, I guess, disproportionate penalty that it imposes on them? Yeah, I think that, there are so many things that are applied across the board that are more difficult and more challenging for some individuals. That's well known to us, and it's really tricky. You can't make individual rules for individual households. We've tried to look at particularly challenging circumstances. The single person bubble was trying to address that. The intimate partner exemptions were trying to address that. But I totally accept that not everyone lives in the same kind of neighbourhood. Not everyone has the same opportunities. For people who live 5 kilometres from a beach, terrific. But not all of us do, clearly. But that will be in consideration as we come to this weekend as well, as we think about that. But it's not easy.
Sorry, can we just finish the 5K? Yes. On that point, considering that there are a lot more measures that you've got in place, like testing people in quarantine, more contact tracing, would you be pushing for that zone to be expanded?
Oh, I'm not pushing for anything. We are reflecting on all of those elements as we come to this weekend about what can reasonably change with what we're facing at the moment. So yes, it's up for consideration, as is everything.
We heard the Premier yesterday say that this could be as good as it gets in terms of case numbers. What's the inverse to for that? What's the ceiling that we can really accept before cases start to get away from us, or before we start to see pockets of lockdown again?
Oh, it's a difficult judgment to make. It's clear that any country that has hundreds of cases per day doesn't do contact tracing at 100%. Doesn't matter where you are in the world. The United Kingdom that's invested $10 billion into contact tracing and has a team of tens of thousands doing contact tracing are getting to about 2/3 of their daily cases at all. Not even in a timely way necessarily. So there are clearly limits to what contact tracing can manage, but we've got a team of a size that could manage dozens and dozens of cases per day, but that is not the entire solution to how you manage transmission risk. So masks and distancing and the behaviours that people engage in routinely, keeping that 1.5 metres as they go shopping, as they buy food, are absolutely critical measures in the mix. That applies across the world at the moment. It's a different way of living, and it's not easy to change some of those habits, although it's pretty clear that we've habitualised a lot of those really important things. But contact tracing cannot do the entire work of preventing transmission, because the human behavioural elements are really critical as well.
So is there a figure of where the Victorian contact tracing team starts to become overwhelmed?
No, I don't know that there is. I think, again, it's not even a question of being overwhelmed. It's a question of what drives transmission. And when you do contact tracing, you've already got a case. You're following their close contacts and you're managing their quarantine. But the risk of transmission also relates to how each and every person moves around before they become symptomatic, when they're infectious, and then how they're interacting before they get notified to the department. They're things that are not within the control of any contact tracing team anywhere in the world, because they're things that happen before a case is even notified. So they are really critical elements as well.
Of those 11 cases that have been linked to outbreaks, do you have a rundown of what outbreaks?
I do. So one's a household contact of a known case in the Chadstone outbreak, so obviously in quarantine. One linked to Estia Keilor aged care. 7 linked to a case from Box Hill Hospital outbreak, including 4 cases from the same household. 1 is being investigated for links to the Chadstone outbreak, a separate one. 1 with links to Uniting Agewell in Preston. And the last one, I'm presuming, is the Geelong case that the Premier alluded to. I think that's residual virus, probably dead virus, still gets picked up with the viral fragments on a swab, but isn't infectious. But we need to be clear that it's not a reinfection. They're rare events. They can happen for people who've been previously infected. So there'll be a review by an expert panel of that today. But I'm pretty confident that will be regarded as a residual infection and won't be counted in today's numbers.